Hello everyone. In this video, we're going to be talking about the pathology of cystic fibrosis. So let's start. So what is this disease? So it is an inherited condition in which there is a disorder in the transport of irons, and this affects the fluid secretions. A lot of organs are affected here, including the respiratory tract, the GI system, the reproductive tracts, etc. Now, how is it inherited? So it is an autosomal recessive condition, and the affected gene here is located on the chromosome 7. The most common mutation here is the deletion of the phenylalanine on the 508th position. So delta 508 is important to remember. Now, what is the pathogenesis? So let's understand it with this picture. So here we have a channel called CFTR. This is responsible for the transport of three important things. Those are chloride, bicarbonate, and water. Water can also go through osmosis, but it also goes through here. Now all of these three go through the CFTR and are responsible for the production of the mucus. But now let's see what happens in this disease. So again we have these three and the CFTR is not working. If it is not working, the mucus will become acidic, it will become chloride deficient, and it will also become very thick because the water is not able to go. Now let's see the other effects. So here again we have the CFTR and here we have the ENaC. So ENaC is basically a channel which is responsible for taking the sodium inside the cell. Normally this CFTR inhibits the ENaC, but here as the CFTR is not working, the ENaC is no longer inhibited. If the ENaC is not inhibited, it is going to work overtime and a lot of sodium is going to come in. Due to this, the secretions are going to become hypotonic. But there is an exception that you have to remember, which is seen in sweat glands. What happens here? So again we have the chloride and the sodium. Here the CFTR is responsible for absorbing the chloride. So if CFTR is not working, the chloride is not going to absorb and is going to increase. Here the ENaC will also not work and the sodium levels are going to increase. So if NaCl is going to increase, this will lead to what we call as salty baby syndrome. So whenever the mother will kiss a child who has this disease, she is going to say that my baby is very salty because the sweat will actually have a lot of NaCl. Now what are the clinical features? So let's go system by system. Let's see what happens in the respiratory first. So as we just saw, there will be very thick secretions here. This will lead to secondary obstruction and infection, and this can finally lead to severe chronic bronchitis or bronchiectasis. I've made videos on both of these topics, so please go check those out. Some important bacteria that you have to remember are Staph aureus, Haemophilus influenzae, Pseudomonas aeruginosa, which can actually form a biofilm and can cause very severe infection. And finally, Burkholderia cepacia. The upper respiratory tract can also get involved and cause nasal polyps and recurrent sinusitis. Now let's see what happens in pancreas. Here the pancreatic secretions become very thick and viscous, and they can actually plug the ducts. This can lead to atrophy and fibrosis of the pancreas. So pancreas, as you know, has two functions, the exocrine and endocrine function. If there is atrophy and fibrosis of the pancreas, the exocrine function is not going to work and will decrease the amylase and lipase. This can lead to malabsorption syndrome. On the other hand, an impaired endocrine function is going to decrease the insulin levels and can lead to secondary diabetes mellitus. This is very important to remember. Now in the liver, it can cause blockage of the bile canaliculi, can also lead to prolongation of physiological jaundice and cause secondary biliary cirrhosis. Again, very important. Now in the intestine, what can it do? It can cause meconium ileus. So this is basically a condition which is seen in newborns where the stool becomes very thick and sticky and does not pass. So this can actually obstruct the distal ileum and cause a lot of problems to the baby. Just a side note, the investigation and treatment of choice for meconium ileus is gastrografin enema. Now in the genitourinary system, it can affect both males and females. In the males, it can cause agenesis of vas deferens, and in females it can cause very thick cervical mucus. Both of these can lead to infertility. So infertility can be a very important hint given in the question that you have to pick up. Now, how are you going to diagnose this condition? So we can do a sweat chloride test. How? We will give pilocarpine to stimulate the sweat glands. And if the sweat chloride is more than 60 milliequivalents per liter, we can say that the person has cystic fibrosis. But if you did it 2 times and once it came positive and once it came negative, we can actually do another test called transepithelial nasal potential test. Now we can also do genetic testing which will show us a CFTR mutation. It is the most accurate one. We can do a chest x-ray which can show non-specific signs such as a tram track appearance, which is mostly seen in bronchiectasis. I've covered this part in my bronchiectasis video also. We can do pulmonary function tests. So initially, it may show as an obstructive disease, where the FEV1 to FVC ratio is decreased. We can check the HbA1c levels to see if the person is suffering from diabetes or not. And if it is more than 6.5, we at least know that the person has diabetes. We can do sputum culture to check the bacteria also. Now, how are you going to treat this condition? We will give DNase or Dornase alpha, which will make the secretions very thin. We can give ivacaftor, which will improve the conductance of chloride. Because remember, the chloride was not able to pass through, right? So this will help in the transport of chloride. Now we can give N-acetylcysteine followed by a beta-2 agonist nebulization. We'll also give antibiotics and supplement the body with pancreatic enzymes and of course vitamins. So that's it for this video. If you have any doubts, so please leave them in the comments or you can reach out on Instagram anytime. I'll try my best to clear all your doubts. The link to my Instagram is in the description. Thank you.